Hey guys, it's Beth from Cantano Wellness, and today I want to talk a little bit about our hamstring muscles. So, the hamstrings are three different muscles that all originate in the same space here at the ischial tuberosity. Um, and then as they go down the posterior thigh, they kind of split off and insert in different places. So, the three hamstrings are the semitendinosus, the semimembranosus, and the biceps femoris. So we know biceps femoris is going to have two heads. So the long head comes from the ischial tuberosity, and the short head along the linea aspera of the femur, kind of between the quads, vastus lateralis and vastus medialis. But both of those come down and they do an insertion out here laterally on the fibular head. So they're going to move from here down and across this way. And then we've got semimembranosus, and semimembranosus stays posterior, but comes down and inserts on the posterior medial condyle of the tibia. And then we've got semitendinosus, which makes kind of an interesting little forward jaunt and ends up here at the pes anserinus tendon. So while all of these do flexion at the knee, right? This extension at the hip, that would be having her lift her leg up off the table. When they get to the knee, they both do rotation, but the semis do medial rotation and biceps femoris does lateral rotation. So they switch off a little bit based on which side of the knee they insert on. So to work on them, we're going to to work on them we're going to work from the ischial tuberosity and down the posterior thigh. Now you can warm these up obviously with some great effleurage strokes, and then you can come in with your forearms and go right up into that ischial tuberosity. Now if you're uncomfortable about your hand being in the middle of your client's leg, use your other arm. But what I want you to do is to make sure that you're always pointed in the direction that you want your pressure to go in. So these are just long effleurage strokes, just like you do with your hand. You can use your fist to do that as well. Now, it's kind of fun to use your fist because you can sort of start on the condyles and then come up to the center. You can always do some lovely petrissage where you're lifting that tissue. The hamstrings are not as big as our quadriceps. They're more of a parallel tubular muscle, but they're super important to the back of the leg. So make sure you give the hamstrings a good bit of attention as you're working on your clients. And in the comments section, let me know what your favorite technique is to work on the hamstrings. Y'all take care, have a great day, and I will talk to you soon.